Well, thank you for joining us today. I want to start out by thanking those who are behind the cameras here, who are working in this operations center, first to help respond to COVID-19, now additionally to help respond to Hurricane Hanna. Any hurricane is an enormous challenge. This challenge is complicated and made even more severe, seeing that it is sweeping through an area that is the most challenged area in the state for COVID-19. Our hearts go out to everybody in the entire region affected by the hurricane. Our efforts will go toward addressing those impacted by the hurricane with a concentrated focus on making sure that we as a state do all that we can to continue protecting everybody in the swath of the storm from the spread of COVID-19. The most important thing I could say today is to issue a reminder to everybody in the state of Texas that just because a hurricane comes to the state does not mean that COVID-19 disappears. This is a time in response to a hurricane where sometimes people will come together to shelter, come together just as close family, come together as friends, come together to respond. That coming together will continue to provide the ability for COVID-19 to transmit from one person to another. Hurricanes can be deadly events. Unfortunately, I have not yet heard of a death resulting from Hurricane Hanna. But we cannot allow this hurricane to lead to a more catastrophically deadly event by stoking additional spread of COVID-19 that could lead to fatalities. We're very, very concerned about the status of the storm and what it will be bringing in the coming days and hours. We are seeing hurricane-level winds lash the shoreline. We are already seeing and will continue to see dramatic waves of flooding, including flash flooding that will come upon people suddenly. One moment they will be in an area, it could be all the way over to Laredo, where it seems like there is a little rain, and then moments later, they could be awash in water up to their doors if they're in their cars, up to their knees if they're walking around. So as we speak, the hurricane is in the process of making landfall. The highest risk, as I pointed out, is heavy flooding in many regions, most of all in the Rio Grande Valley area, where people should expect to experience flash flooding and severe high-level flooding. This flooding is so severe that it can be very life-threatening. Everybody that's in the zone of where either this hurricane or the flooding may occur, you need to take precautions to make sure that you protect your own life, knowing that you can keep yourself out of danger's way by making sure you do not go out into the storm. There will be possibly, probably, substantial property damage, in large part because of flooding, but also in part because of the winds whipping around the entire region affected by Hurricane Hanna. In some areas, especially along the coastline, especially in the Corpus Christi, Nueces County area, you can expect storm surges of up to 4 to 6 feet. Comprehend that size. You will see a storm surge as tall or taller than most individuals in Texas. So that shows you the size of the waves that could be coming in and how threatening it can be to the lives of the people in the area. Do not go into that storm area knowing that it could take your life from you if you do so. We also do want to point out the possibility of tornadoes. There has already been one tornado warning northeast of Corpus Christi. There could be others arise, and it's always to be anticipated and expected in the course of a hurricane coming onshore. So in this regard, and also with flooding, it's so important that everyone in the region affected by the hurricane stay tuned to local news agencies and local alerts, so you can be aware of a potential tornado in your region, you can be aware of potential rising waters in your region, so you can take the action that's recommended to make sure that you can be as safe as possible. Already, in response to this hurricane, I have issued a governor's disaster declaration for 32 counties in Texas. This provides the governor the ability to waive statutes or administrative rules that may hinder the response or the recovery. This declaration provides Texas the ability also to ask the federal government for assistance in response to Hurricane Hanna. I'm also issuing a federal emergency disaster declaration request. This request is for public assistance, direct financial assistance, and hazard mitigation assistance. For public assistance, it would provide funds to assist communities responding to and recovering from major disasters or emergencies declared by the President. The direct financial assistance would allow us to access direct federal assets to meet critical emergency protection requirements, for example, for federal search and rescue teams. Hazard mitigation would also be a component of this, and it would provide assistance for actions taken to prevent or reduce long-term risk to life and property from natural disasters. I'm proud to say that we are partnered today by both FEMA and the U.S. Coast Guard as the state and local governments respond to this challenge. Speaking of local governments, I've had the opportunity to speak to many of the local governmental leaders in the pathway of the storm over the course of the past 24 hours. And in typical Texas fashion, they were prepared for this storm, working with the residents of their communities, making sure that all was being done to both prepare for and to gird for the forthcoming storm. We have with us a team of state agencies that are stepping up to assist local communities in responding to Hurricane Hanna. With regard to the Texas National Guard, they are providing 2 ground transportation companies, which equals a total of 100 personnel. One of those companies is going to be in Weslaco, the other in Corpus Christi. They will provide 20 high-profile vehicles. 2 more of these ground transportation companies are on standby if needed. They will also have helicopters on standby as needed for rescue missions. The Texas Military Division also is providing 17 mobile testing teams focused on shelters. When I'm referring to testing teams, I'm talking about COVID-19 testing teams. We will be responding in the way that we typically respond to a hurricane, but on top of that, we will be responding in ways that respond to the COVID challenges, and that includes these military division operated testing teams to make sure that we will be able to continue to provide the COVID-19 tests that are needed to help secure the region from the spread of COVID-19. In addition to that, the Texas Military Division will also be working to sanitize shelters where people may be sheltering in place in a way similar to the way that the Texas Military Division sanitized nursing homes to do everything they can to eliminate any type of COVID-19 germs in the shelters that people may be seeking safety in. They being the Texas National Guard, are providing 100 medical personnel available to help with those who may be sheltered. The Texas Department of Public Safety has 390 personnel staged to respond. They are providing 4 helicopters, 2 search planes, 6 rescue boat teams, and can also assist in security operations in the regions affected by this, as well as assisting local law enforcement agencies to make sure that all their duties are adequately addressed. TEACS is providing 8 boats and 30 personnel in the Rio Grande Valley region, as well as 6 boats and 20 personnel in the Corpus Christi region, and 80 personnel staged in Pleasanton, Texas right now to be ready to surge for search and rescue as needed. With those efforts, they have 6 boats and 4 search squads. The Texas Parks and Wildlife, they have announced that parks are closed along the coastline from Galveston all the way to Brownsville, and 3 state parks in the Rio Grande Valley region are also closed. Additionally, Texas Parks and Wildlife Division, they are providing search and rescue teams for water-based search and rescue. They are providing 60 game wardens, 4 swift water boats, 15 shallow water boats, as well as a helicopter with a hoist for rescue if needed. The Department of State Health Services remains actively involved in the COVID-19 response during the course of this hurricane. Related to that, they are setting up medical shelters. They will primarily use these medical shelters to provide for those who have medical needs but don't need to be hospitalized. One of these shelters will be set up at the Freeman Coliseum in San Antonio with a capacity of being able to treat and hold up to 100 people. There will be an additional facility prepared to be open in Pharr, Texas, where they will be able to set up and treat up to 40 to 60 people. The Texas Department of Transportation they actually worked in advance to clear culverts and ditches in the area to be prepared for the oncoming rains and flood waters. They are working on road closures, and they are providing 30 high-profile vehicles on standby. They have a website address you can go to check out for closed roads, and it's called drivetexas.org. That's drivetexas.org to find out about road closures in the area impacted by Hurricane Hanna. The Texas Division of Emergency Management, Chief NIMKID will tell you more about that, but I will tell you that they continue to surge personal protection equipment to the region. We know that there will be even an escalated need for access to that personal protection equipment. They have food and water available for anybody who will need access to that food and water, and part of that will be through the Texas Division of Emergency Management. Also, part of that is being provided by FEMA. And they are preparing for debris cleanup. We all know in the aftermath of a hurricane, debris cleanup is something very important. I would like to once again both recognize and thank the Texas Legislature for all they did this past session to create a very robust system to respond to hurricanes like this, including the additions they added to Texas statutes concerning debris removal and cleanup. And it means that Texas is even more prepared to deal with Hurricane Hanna than we were in the aftermath of Hurricane Harvey. So I will pass it to NIMKID, but before I do, I want to emphasize one thing once more, and that is as people are doing everything possible to protect their lives and loved ones from the storm and the damage the storm can cause, I strongly urge you to remember to do everything you can to protect your lives and loved ones from the transmission of COVID-19. Do not, in haste, take action that could cause you, a family member, or a loved one to lose their life in the coming weeks to COVID-19 by disregarding all of these practices that we've become accustomed to using, such as wearing a face mask as you respond to COVID-19, maintaining distance where possible, and most importantly, avoid gatherings of more than just a few family members. With that, I'll pass it off to Chief NIMKID.
Thank you, Governor. As the Governor said, this is a very dangerous storm. The wind will be part of our concern, but mostly we'll be concerned with the rainfall and the flooding. And need to remember, turn around, don't drown. If you do not have to be out in this weather, do not get out in this weather. Please stay high as you can, and there's no reason to get out and travel just to go and look and see what's going on. Second, our local, state, and federal partners are working very close to each other with the priorities of life safety, property conservation, and environmental protection. We're doing that through providing rescue assets to our local partners in consultation and cooperation with our federal partners. And then at the local level, we've talked to several officials this morning that will be opening emergency shelters in their jurisdictions. If you had the chance to evacuate and are on your way now, the City of San Antonio and Bexar County has opened up the Freeman Coliseum as a reception center, and the American Red Cross will be providing hotel rooms for people that make their way into San Antonio. As the Governor said, we'll continue to provide personal protective equipment, testing and cleaning in all of our shelters, working very close with our private contractor partners to get debris cleaned up as soon as possible. We'll continue to push for the disaster declaration to support our local governments and our citizens. And finally, I would like to thank all of the local officials that are out there, Governor. In the midst of this pandemic, they have been planning, training, and exercising for hurricane response. It was last week and a half ago that we've had virtual exercises with all of our coastal partners to respond, and so I know they're engaged and they're ready.
And that's worth emphasizing because back in May, you and teams were working on this very scenario. We did not come to this today or yesterday by any sense of surprise. At a time when we knew COVID already existed in the state of Texas, the Texas Division of Emergency Management was working with those behind us right now, as well as with local officials, to be sure that we were prepared in the event that a hurricane did arise, and that preparation months in advance is paying off today and in the coming days. We'll take a few questions. Sure. Sure. Chief.
So, Jenna, I think I heard the question right. How many tests will each team be capable of delivering? And the answer is hundreds per day. We'll be using the curative test, which is the oral swab test. We've been seeing lab turnaround times after transportation to really be about 20 to 24 hours. And so to get in and test within those facilities, the other thing the military department teams are capable of doing is surveying people to see who's sick and who's not sick right there, so we can segregate as much as possible. And so we'll see those people come in to do the cleaning, do the testing, and get those results back. If we need to open up additional space for people to quarantine, we will be using hotel rooms. We don't want to set up any more congregate settings than we have to. Yes, ma'am. So shelters, normally when you come in, you check into a shelter, so that at the local level, the folks running those shelters should have the names and addresses of the people that are in the shelter. If there is a positive, that will be the basis to do any contact tracing at the local level. Yes, ma'am.
Yes. So right now we are surging PPE into the area to make sure that all of the PPE needs will be met. This storm could slow the robust testing that was in place for a day or two while the communities get stabilized. And so there could be a possible decrease in the number of people being tested. But we will be prepared to go in and surge testing in the coming days and coming weeks to help the communities respond to the COVID response aspect of this hurricane.
So when it comes to social distancing in shelters, how is that going to work?
So as Chief Kidd was talking about, we planned in advance for strategies to make sure that in people who are going to shelters in response to a hurricane, that it would be different than what has been done in the past. In the past, they've been going to gymnasiums or convention centers, things like that, where you would be bringing a lot of people together. Here it's important to keep people separated, and hence we have hotel rooms set up to make sure that family units will be able to stay in one hotel room themselves without exposing themselves to others. Sure. Go ahead.
Sorry, Governor. Two aspects of the Freeman Coliseum. One would be the medical sheltering aspect of it, of where you would have people very much separated. The second, the Freeman Coliseum, how we used to use that as a shelter reception hub, will now be a hotel reception hub. So we spoke with the Vice President of the American Red Cross last night. They're providing hotel vouchers. If they run out of vouchers, we will contract for hotel rooms. But the idea is you come and check in at the Freeman Coliseum and then go to your hotel, not go to a shelter unless you have a medical need. You'll be determined if you need to go to a hospital at that point, and if not a hospital, then you'll have the medical shelter if you have medical conditions that require such.
Just out of curiosity, do you know about how many hotel rooms the state has prepared for people who are looking for shelter?
Well, it's not a busy travel season in San Antonio right now. We talked to the city manager this morning, and he says they have plenty of rooms.
Facilities that house vulnerable populations like nursing homes, what guidance and assistance are they being given this hurricane season?
So we've worked very close with all of the nursing homes through the testing and the cleaning. We know exactly where they are, how many residents they have, and all those addresses will be shared with our search and rescue partners if there's any need to do that. If we need to evacuate a nursing home at this point, we still have all of the resources that we've had in every hurricane season to do that. The difference will be we'll be wearing more PPE than we would have in the past.
Governor, with the $600 extension on unemployment expiring, 3 million Texans unemployed, do you support the extension of that $600 supplemental income for people who are unemployed?
I think it's important that we continue to help Texans who are working through this process of navigating a pathway forward from COVID-19, and I'm confident that the U.S. House and Senate will reach an agreement that will be helpful to our fellow Texans. I want to see the House and Senate work collaboratively toward helping both individuals as well as communities in the state of Texas. Yeah. I support the United States Congress working with the President to help fellow Texans in the way that they find is going to be most important and effective.
Resources from the Austin area? So very few from the Austin area, unless they're part of Texas Task Force 1 that's been pulled up, or one of the emergency medical task forces. Really, the team behind us has done a great job of not pulling any of the COVID responders off of the COVID mission to go and do this. These are additional resources above and beyond what the state has been focused on COVID with.
How do you divide the PPE surge between the first responders and the people that may need to go to a hotel room, or go to shelter, or who are
We make sure everybody who needs PPE will get PPE.
Yeah.
So you'll know, and they've done such a fabulous job of making sure that we have ongoing supply chains of PPE, that we have plenty of PPE available to make sure that the PPE needs of everybody both affected by the storm and affected by COVID-19 will be able to receive that PPE.